We will talk about easy forgetfulness, what causes it, what is normal, and what indicates memory loss due to diseases. We'll discuss when to worry and how to improve memory. Not all forgetfulness or memory worsening signifies disease. For example, after 60, occasionally forgetting names but recalling them later or having difficulty finding the right word is a normal part of aging. However, if memory loss significantly interferes with daily life, we should investigate the underlying cause. When we memorize things, there is no physical storage for information in the brain. Instead, new neuronal connections and pathways of electrical impulses create memories. Anything that damages our brain's ability to create these connections will affect our memory. For example, the most common cause of forgetfulness is stress and anxiety. Stress and anxiety increase cortisol levels, a stress hormone that can interfere with the hippocampus, the part of the brain responsible for forming new memories. Elevated cortisol levels also impair synaptic plasticity, the formation of connections between brain cells, directly affecting our memory. Therefore, constant stress makes it difficult to learn new things. On the other hand, acute stress affects memory differently. During acute stress, adrenaline and noradrenaline are released, activating the amygdala, the center of emotions, which then activates the hippocampus, the learning center. This is why we remember childhood stories vividly, because they involved strong emotions, while we easily forget everyday adult events. This principle is why simulations of emergency situations like fires, combat, or medical settings are common practice. They enhance learning through strong acute stress and emotions. The second most common cause of impaired memory is lack of sleep. Deep sleep and REM sleep are crucial for long-term memory formation from the hippocampus to other brain parts. For most adults, 7 to 9 hours of sleep is optimal for health and memory. Depression is the third most common cause of impaired memory. It causes an imbalance of serotonin, norepinephrine, and dopamine, affecting cognition and memory. Chronic depression can lead to reduced volume and atrophy of the hippocampus, which is involved in forming and retrieving new memories. Depression affects both short and long-term memory because depressive symptoms like fatigue, low motivation, and poor concentration reduce the ability to pay attention and encode new information effectively. When we hear or see something, we remember it only for several seconds. This is called sensory memory. For example, when you glance at a billboard while driving, you can briefly remember the image or the message even after you've looked away, but this memory fades within seconds. If we pay attention to something, we memorize it in our working memory, also known as short-term memory. For instance, if someone tells you a phone number, you can remember it long enough to dial it, but you might forget it soon after unless you rehearse it. To learn something for the long term, we need to rehearse it many times, which is called long-term memory. For example, to learn a new language, you need to practice vocabulary words repeatedly. Depression affects all three of these steps. The fourth most common cause of impaired memory is medications. Especially antidepressants, antipsychotics, allergy medications, especially older generations, sedatives, and even blood pressure medications, particularly beta blockers, can negatively affect brain neurotransmitters and memory. The fifth most common cause of memory problems can be Alzheimer's disease, a serious neurodegenerative disease that worsens over time. While no effective treatment exists, slowing the progression to some degree is possible. Alzheimer's usually starts after 65, but in rare cases, it can occur before 50. Common signs of Alzheimer's are memory loss affecting daily life. For example, a typical Alzheimer's patient might be a 75-year-old person whose family notices he repeats the same questions and has difficulty participating in conversations. Over time, he becomes more withdrawn and exhibits mood changes, like irritability and anxiety. Alzheimer's disease primarily affects short-term memory, making it difficult to learn new information. During Alzheimer's disease, clumps of protein called beta-amyloid accumulate outside neurons and form amyloid plaques, damaging neurons and disrupting normal neuronal connections. Inside cells, tau proteins, which normally stabilize microtubules, become hyperphosphorylate and form twisted threads called neurofibrillary tangles, further damaging neurons. Other diseases can also cause memory problems, such as frontotemporal dementia, vascular dementia, Lewy body dementia, dementia after a stroke, and even Parkinson's disease. However, these are generally rare, or their primary symptom is not memory-related. Now, let's discuss how to improve memory. Exercise. One of the most evidence-backed methods is exercise. Optimal moderate exercise, such as 1 hour per day, can significantly improve memory by enhancing blood flow to the brain. Numerous studies have shown that aerobic exercise, e.g., walking, running, swimming, significantly improves memory and cognitive function and reduces the risk of cognitive decline and Alzheimer's disease. Diet. The Mediterranean diet, which includes plenty of fruits, vegetables, whole grains, fish, and healthy fats like olive oil, has been linked to improved cognitive function and a lower risk of Alzheimer's. Cognitive training and mental stimulation. Engaging in cognitive training and mental stimulation enhances neural connections and cognitive reserve. Studies show that reading, playing musical instruments, playing chess, and learning new skills improve memory and cognition and decrease the risk of Alzheimer's. Stress management. Managing stress is crucial for memory improvement. Practicing mindfulness meditation for 10 to 20 minutes daily, engaging in regular yoga sessions, or using deep breathing exercises can help manage stress effectively. Social connections. Maintaining strong social connections and engaging in social activities can help protect against cognitive decline. Social interaction stimulates the brain and improves mental well-being. Supplements. Omega-3 fatty acids. These are well studied for their benefits in cognitive health. Omega-3s are important for cell membrane production in the brain, improving synaptic plasticity and reducing neuroinflammation. Regular intake is associated with a reduced risk of cognitive decline and dementia. Numerous studies and meta-analyses have shown that omega-3 supplementation can benefit cognitive health, particularly in older adults and those with mild cognitive impairment. Ginkgo biloba, believed to improve cerebral blood flow and has antioxidant properties. It enhances cognitive function by increasing blood flow to the brain and protecting neurons from oxidative damage. It has been shown to improve memory, attention, and cognitive speed, particularly in older adults with mild cognitive impairment or early dementia. Phosphatidin, a phospholipid that is a crucial component of cell membranes in neurons. It plays a role in cell signaling, neurotransmitter release, and synaptic function. Phosphatidin supplementation has been shown to improve memory, mood, and cognitive function, enhancing attention and mental processing speed. Clinical studies have demonstrated that it can improve cognitive performance in aging individuals and those with cognitive decline. Vitamin B12, essential for maintaining healthy nerve cells and producing DNA and RNA. It plays a crucial role in the synthesis of neurotransmitters and the maintenance of the myelin sheath that surrounds nerve fibers. Adequate vitamin B12 levels are vital for cognitive health.